In this video, we're going to look at some spinal segmentation, some hip, ankle, knee, and toe cars. So this will be part of your routine after you've done your breath work, so we can get a little space into the spine before we start to move it. So we're going to come onto hands and knees. Okay, you're going to try to tuck the toes under if you can. Keep the elbows really soft. Let the head be in neutral. Don't tuck it all the way in. We're going to start in flexion. Starting from the tailbone, you're going to try to keep everything else in the rest of your spine the same. Make sure we're not drawing the shoulder blades up to the ears. Keep everything in the upper shoulder / neck area as relaxed as you can right now. So starting from the bottom, take an inhale. And just continue with easy nasal breathing. Flip the tailbone up to the ceiling. You're going to unwind your spine as close to one vertebrae at a time as you can. I want you to actively squeeze into extension. So I want you to feel those back muscles working. And your head is the very last thing to rise again. Keep those elbows soft. You might even drag your hands isometrically. So without moving them towards your knees. Then from the bottom, we're going to start again. Rewind. Tuck the tailbone. Keep as much of the upper back the same. Keep the elbows soft. It's going to be tempting to drive those elbows straight, but try to keep them soft so we have some space for the spine to move in between the shoulder blades. Let's go one more time. Feel those spinal muscles engage as you walk your way up the spine. Notice which parts of the spine feel more challenging to engage those muscles. And then in reverse, you're going to feel some abdominals work and the muscles in the front side of your spine. Tuck the chin in, but don't drive it down. Just lightly kind of tuck it in towards the collarbones and then relax. I would probably do that for 2 or 3 minutes total before you move on to the rest of your cars. For our hip cars, we're going to do them in side lying position today. Take a block or a roller or a pillow underneath your head. You're going to take your top hand, place it down on the floor, and then reach the elbow away from you. We want to try to minimize rotation of the trunk backwards. We're going to tuck the tailbone just a little bit, so we'll round through the lower spine. Top leg lifts, pull it in towards the elbow, up towards your rib cage if you can. Open up just like a door. Try not to let everything collapse and roll backwards, but your rib cage and your pelvis are moving forwards, just your leg that's moving back. Rotate internally. So we spiral the heel back. This leg goes all the way back, all the way back, all the way back until the front of this hip gets flat or extended. And we're going to go again, knee to chest, open up like a door. Internal rotation, spiral back. We really want to feel every part of that hip moving. One more lap in this direction. When we get here, back to the beginning, we're going to reverse it. So kick back, try to feel the glute. Try your best to tuck the tailbone as you kick the leg back. Open up and start to take that leg forward, up towards your rib cage and back. Reach, squeeze the glute, open up. Knee comes up to your chest. So we should really feel a lot of heat, a lot of effort through this hip. Back down, we're going to rest and then go to the other side. Top hand down, elbow reaches, big breath in. Glue everything in place except for this hip that's moving. Open up like a door. Now I want you to imagine that you're moving through something a little thicker than the air, like water or sand. Molasses kind of comes to mind, but it's a little bit of an icky image to have in your head. So just use whatever works. The point is we want some resistance here so we can increase the effort that is driving through the hips. Next time we come to our chest, we're going to reverse it. Kick back, rotate up, open your thigh, come up towards the rib cage. 2 more. Little creaks and cracks and clicks and pops are all very normal. Very, very common. Unless there's some pain associated with them, we can usually just let them go. Finish out that rep. And we're going to move on to our knee cars. So we're going to come to a seat. First, we're just going to very gently move our patella or kneecap side to side, front to back, and a couple of circles in each direction. We just want relative movement. Doesn't have to be a ton, but we want to make sure that it can move equally, as close to equally as you can in both directions, side to side, in both directions, up and down, and then in a circle a couple times in each direction. Okay, moving on to our knee cars. We're gonna hug one arm of the same side underneath our leg. We're gonna pick it up like a forklift, and then you're just gonna wrap your other arm either underneath or just across. I like to hold on to my knee for this. You can lean up against a wall or a couch or something like that as well. Upper half of your leg stays still. Lower half is what we're moving right now. Toes to your shins. Pretend you got a ski boot on. Don't let your ankle move around. Take a nice big breath. You're going to rotate out. Your heel's going to come in. Your toes are going to point out. We're going to straighten just a little bit, not all the way. Rotate the other direction. Bend all the way. Squeeze your arm. Rotate. Up. Rotate out. Down. One more. And if you notice my heel's actually creating a little smiley face or a little arc shape. That's what we want. We're going to reverse it. Rotate internal at the bottom, up, external at the top, down. Two more. Again, play with some resistance here, right? We want these to be very mindful, intentional movements. We don't want you to just do this to check it off your list. We're going to hold on to the same leg. Now we're going to try not to move the lower leg either. Nice slow ankle rotations. Make them as big as you can while still maintaining control. And reverse. Notice which spots feel a little jumpy or spots that feel like you're moving really quickly through. Other side. All right, forklift that leg up. Take your other hand and just lock it in place. Just give yourself a good bear hug. Pull those toes up. Remember, we got our ski boots on. We're going to rotate out. This time, let's see if we can focus on the hamstring, what that feels like. Outer hamstring will rotate this way. We're going to kick it up. Internal rotation at the top, so your inner hamstring starts to fire, and then bend all the way. So see if you can feel that this time around when we're doing our knee cars. One more. Up, in, down, and out. We're going to reverse it. In at the bottom, up, out, and down. See if you can add a little bit of resistance to this. All right, we're moving through sand or water or something that gives us more resistance than the air. Last one. Beautiful. We're going to keep holding on to this leg. I like to slide it a little bit lower and then go for your ankle cars. And reverse. Again, cracking, popping, clicking, crunchy, all normal, all expected. Everyone has that unless it causes pain. It's nothing really to worry about right now. But as always, let's keep the range of the cars, the size of the circle small enough to stay out of pain. If you don't have any pain, make them as big as you can without the other joints next to it coming into play. Okay, onto the toes. We're going to try to lift our big toes up and down. We're going to go 5 times each. 2. You can do this one at a time if that feels better, more accessible. 5. Notice when you lift your big toe, does the head of the big toe, the ball mound, does that stay on the floor? Because we want that to stay on the floor. Big toes plant down. Other 8 lift and lower. Lift, lower. 3, 4, 5. Everything is going to lift. Again, balls of the feet are down, right? I'm not lifting my whole foot. Pinky toes down first. We're going to try to piano key from the outside in. A few more like that. Pinky toe down first. Try to spread your toes as wide apart as you can get them. 2 more. Again, one more thing to notice is if your feet are rocking side to side when you're lifting or lowering the toes, just notice, okay? And when we refine them, we're gonna try to keep the feet really even. We're not gonna roll from side to side. Okay, give that a try and see how it goes. You could even play around with alternating big toe movement or other toe movement and really feel when you push those feet down, when you get those toes to move, just be cognizant of the engagement in the arches. That's exactly what we want here.